Extensive preview there of the final presidential debate, which you can see live from Nashville, Tennessee, right here on BBC News this Friday at 1:30 GMT. Stay with us, still to come. How the candidates in the race for governor of the US state of Utah are bucking the trend for animosity among contenders.
A historic moment that many of his victims have waited for decades. The former dictator in the dock, older, slimmer, and as he sat down, obedient enough.
Dawn, and as the sun breaks through the piercing chill of night on the plain outside Coram, it lights up a biblical famine, now in the 20th century.
The depressing conclusion: in Argentina today, it is actually cheaper to paper your walls with money.
We've had controversies in the past with Great Britain, but as good friends, we have always found a good and lasting solution.
Concorde bows out in style after almost 3 decades in service, an aircraft that has enthralled its many admirers for so long taxis home one last time.
Hello again, this is BBC News. Let's remind you of our top stories. The American spacecraft OSIRIS-REx has completed its audacious manoeuvre designed to grab surface rock from an asteroid. And soldiers have opened fire on anti-government protesters in the Nigerian city of Lagos, with reports of at least 20 people killed. Greater Manchester will join the Liverpool City region in the toughest tier of coronavirus restrictions from Friday morning, without a financial deal being reached between the government and local leaders. It means pubs will close unless they're serving food, and nearly all household mixing is now banned. Politicians in the northwest had asked for £65 million to support the lowest paid. A government offer of £60 million is said to still be on the table. Meanwhile, scientists say they have found a way to identify people who are more likely to develop so-called long COVID. Most people recover from the virus within 11 days, but the study shows 1 in 20 is ill for at least 8 weeks. The research found that old age and having 5 or more symptoms in the first week of the infection increases the risk of a slow recovery. Our health correspondent Catherine Burns reports.
Vicky Bourne says she was the fittest she'd ever been at the start of this year, from ziplining on holiday to going to the gym several times a week. But she got COVID in March and says she's had wave after wave of illness ever since.
Ankles or my wrists will suddenly get very sore and swell up. I lost my sense of taste and smell again. It just went completely. I've definitely got some brain fog. I get really wheezy and breathless, and I have to use an inhaler twice a day now. My concentration is much shorter. I presumed pleurisy because it felt like I had barbed wire trying to get out through my ribs. I can't breathe as much as I would like to. It's not huffing and puffing, it's just a lack of breath, which is really scary.
Researchers think thousands of people in the UK are going through something similar. They asked volunteers to log their symptoms on the COVID Symptom Study app and found that most said they were back to normal in 11 days or less. But they estimate that 1 in 7 people who get ill with coronavirus will be sick for more than a month, which is how they define long COVID. Then longer COVID. They think 1 in 20 are affected for more than 8 weeks, and that 1 in 45 are likely to be sick for more than 12 weeks.
I haven't been able to work for 7 months now.
The government's worried about long COVID too. It's put out this film with people who are suffering from it.
It can totally wipe me out just doing basic things.
The Department of Health and Social Care says this research should be a sharp reminder of the long-term and potentially devastating effects it can have. Scientists have used the data, though, to come up with a tool that can predict in 7 out of 10 cases who's likely to go on to develop long COVID.
We wanted to have an idea of how much that might affect people, especially as we are going into a second wave now in the pandemic, where more and more people are going to get exposed to the virus. And so clearly, if people are having symptoms for more than 2 months, that's going to have significant economic and social implications.
The strongest sign that someone's likely to get long COVID is having more than 5 symptoms in their first week of illness. Next, age. Over 50s are slightly more likely to get it. Women seem more susceptible, as well as people with asthma. Vicky is under 50, but she did have more than 5 symptoms and describes herself as vaguely asthmatic. Now, 7 months in, she has good days and bad days, but feels that she's getting better, slowly. Catherine Burns, BBC News.
Brazil says a Chinese-made coronavirus vaccine will be part of its national immunisation plan in one of the first such efforts in the world to fight the pandemic.
Thank you.
Let's get some of the day's other business stories. After 10 days of talks, UK Prime Minister Boris Johnson says that with regret he will impose Tier 3 restrictions on Greater Manchester without local leaders' agreement. As well as shutting many pubs and bars, the restrictions mean betting shops, casinos, bingo halls, adult gaming centres and soft play areas will also have to close, while there is guidance against travelling in or out of the area. Despite all... Now, the pandemic has forced businesses to close and made governments advise people to retrain for different careers. So what does the future hold for jobs? A report out today from the World Economic Forum says automation is increasing at a faster rate than expected and will displace 85 million jobs in the next 5 years. So by 2025, the skills most in demand will be analytical, thinking, creative and flexible, with data and artificial intelligence, content creation and cloud computing as the top emerging professions. Well, let's discuss this with Sadia Zahidi, who's Managing Director of the World Economic Forum. Thanks for being on the programme. It's very interesting reading this report. Just talk us through to what extent the pandemic has accelerated this shift towards automation and therefore jobs being lost.
Thanks for having me. What the pandemic has essentially done is created a double disruption scenario for most workers. So on the one hand, there had been this long-term trend towards automation that has accelerated. And at the same time, workers are in the midst of a downturn in the economy and therefore making it much harder to find their future jobs skills. So how to work with others, more active listening, so better self-management. And then the workers that are currently unemployed are also going in much greater numbers to online training, but they're spending much more time trying to acquire harder skills, trying to acquire IT skills, computer science skills that will help them move into their next profession. So workers have realized the scale of the change, but so far we're not seeing the same amount of effort from governments. Now, with all of the support that's been given, for example, wage retention schemes and other ways that governments have been supporting workers and households and businesses, that now needs to change. That needs to become more nuanced, and it needs to focus more on not just income support, but actually getting workers the right kind of training for their future roles.
But we're talking about long-term scenarios here, aren't we? I mean, the very short term, there are millions of people out of work, and that's a very tough place to be, and then also rethink about training and getting yourself in the right position for a new job.
Yeah, and I think that's what's going to have to change. There has been this extreme focus on the crisis, rightly so, but we will need to look up and start planning for what's coming next. Otherwise, some of the devastation that currently exists and the loss of livelihoods that currently exist, those risk becoming permanent, because workers will need support with the reskilling, upskilling, and support to move into their next role.
Sadia Zahidi, thank you for being on the programme, Managing Director of the World Economic Forum. Stay with us here on BBC News. Still to come, the ultimate work